Hello, today I will be discussing cosmetic procedures, focusing on non-surgical procedures commonly considered minimally invasive. What you know about cosmetic procedures is different from what I know, and I want to make sure that you're better informed after you watch this video. I am sure some of you automatically are thinking boob jobs and Botox already. The aesthetic practices used today are deemed safe by the federal government, and the study behind the work people get done is not as dangerous as you think. Cosmetic procedures thankfully have come a long way. It's actually rumored that these type of body advancements were used as far back as the 6th century BC, but more recently from the 1800s and up. The science behind these procedures have been and are continuously being studied just like any other medical procedure performed. For example, we are seeing a correlation behind women with breast implants and having back pain and mysterious sickness. This is now being cited and considered as breast implant illness. Medical professionals have discovered a less invasive way of producing the plump fullness women want in their chest. Breast augmentation can be performed with a fat cell transfer from the patient's own body. Talk about killing two birds with one stone. Being able to do liposuction in one problem area and using those fat cells to produce a fuller chest, very evolving. Not only is this a more natural way of improving your chest size on the rise, but many more minimally invasive procedures and products are approved for the intent of helping someone look their best. Botox and Dysport, two different products approved to lessen wrinkles in problem areas like the forehead or between the eyebrows. These products are manufactured by Allergan, a company highly involved in keeping their products safe and frequently tested for quality purposes. Many people do not like the idea of getting Botox in their face because they connect to the extreme cases out there. When Botox was approved in 2002, it wasn't just new for the patients, but the medical administrators as well. There is not much practice with injecting this foreign material, and because of this, many people overdid the injections, and some people were getting injected by unlicensed administrators over the years, and still are. When done right, and when the patient is well informed of any side effects, the effect of Botox or Dysport is actually very fulfilling. Plus, they are safe. Botox and Dysport are naturally derived from a protein found in bacterium that simply reduces the ability for our muscles to contract. As for fillers, which are used for fuller cheeks, lips, and more, are created with natural hydrating hyaluronic acid, which is naturally found in our body's tissues already. It's just reduced as we age. So, let's talk about the bad for a moment. Why do people freak out or judge when someone reveals they receive cosmetic procedures like lip injections or Botox anyway? Well, it's probably because they have seen those horror stories. We have all seen women with their faces swollen shut, or their overfilled lips or cheeks, or their stretched back skin. All of that is not the normal or expected outcome from minimally invasive cosmetic procedures. Let's look at these 3 photos and I will explain why this has happened to each woman. So, I can assure you that the Botox and Juvederm, which is a filler for lip injection, did not cause this naturally. In photo 1 and 2, we see women with their faces swollen shut. As it turns out, their so-called doctor is to blame. A counterfeit doctor used beef gelatin to inject these women's faces, not the FDA-approved Botox. The third photo, we see a woman with her lips extremely big and in risk of capsular death, which is very dangerous. She explained the lady who performed this injection used baby wipes to clean her face, did not wear gloves, had her needles in a plastic bag, and injected her lips from only one angle. Yikes. This is why cosmetic procedures have a bad rep. The government is cracking down on illegal med spas, and as the patient, you should do your homework just as much. Always find out about the person you are going to see. Now, we also have to remember a lot of these aesthetic procedures are fairly new, and they are getting much better with time. Also, like any medical procedure, it's very important for humans to have this right. Having the ability to easily take away your problem areas builds confidence in the patient. And the act of cosmetics is an art of science. The cosmetic procedures available bring joy and happiness since people are always looking to be the best self they can be. People overthink their looks, and if they can change them, their confidence can help them live a better life. Like how professional clothing can help someone score a job or even feel better about the way they are, the way they look, being able to remove wrinkles can have someone feel more comfortable, which leads to success. We also must remember cosmetic procedures should not be judged as women-only practices. There is the term Botox for a reason. Men have problem areas too, and if they want to allow themselves to be the best them, they will have a way to do so with these products. It's important to remember looks mean a lot to humans. We get up every day to get dressed, comb our hair, etc., just to impress ourselves or others, because the first thing we do is look. Just as men can get into fashion, they can get into cosmetic procedures to better their looks. And to recap a bit, there is a difference in the aesthetic procedure routes people can take. Invasive versus non-surgical. For example, someone who has a bump in their nose may be tempted by the idea of rhinoplasty, but there's actually another way. Non-surgical injections like Juvederm actually allow people to inject this naturally hydrating hyaluronic acid into their nose as a filler to avoid the bump in their nose. Here are some photos for example. Amazing. The main difference between choosing surgical and non-surgical is the intensity of the procedure and the cost. I myself really enjoy the fact that non-surgical procedures are affordable and they are not permanent. For example, this nose job would probably only be around $700 to $800, while the rhinoplasty would probably be around $8,000. The rhinoplasty is permanent, while the injection can last anywhere from 3 months to 2 years, depending on where it's injected. Plus, filler can be dissolved. If you don't like your procedure, no sweats, it's reversible. Plus, do remember our government is very involved in the medical aesthetic world. Every person who injects a patient with any substance for cosmetic purposes must be at least a licensed LPN and work under the wing of a physician. And the material in the syringes are deemed safe by the Food and Drug Administration, which under a lot of testing before they are approved. I myself praise the cosmetic medical field. I believe people should be able to have a right to look better and be safe while doing so. I wouldn't back these procedures without knowing where they came from and going through some myself. I have gotten Botox and Dysport for years and have paid for face fillers in the past. My only concern was knowing my doctor and being cautious about the pre and after care guidelines given to me. I have not had any issues with any of my procedures and will continue to support the cosmetic medical field. I hope now that you are able to understand a bit more about the cosmetic world and understand there is a difference between surgical and invasive procedures, but understand that they all have been tested and are deemed safe as long as the procedure is done properly.